Hello and welcome to this calf management series, Raising Gold Star Calves, part 1 of 4. My name is Jen Bentley, Iowa State University Extension and Outreach Dairy Field Specialist in Northeast Iowa. In this 4-part series, we're going to focus on newborn calf care and colostrum management, nutrition of the pre-wean calf, calf housing and environment, and conclude with calf hygiene, economics, and management tools. In order to follow the gold performance standards, there are some management areas that need to be prioritized. These include minimize stress of birth, maximizing passive immunity, reducing feed and labor cost, meeting the nutrient requirements of the calf, optimizing rumen development, and maintaining animal health. What does calf management have to do with the overall dairy operation? Well, ultimately, what happens in that calf's first few weeks and even first day of life will have profound effect on the future of her career as a dairy cow. By managing the calf properly, we can achieve our goal breeding weight at an earlier age, potentially reduce the age at first calving while increasing body weight at calving, and raising high quality calves can increase potential for internal herd growth, potential increased milk yield, and overall quality and longevity of the herd. And we know that heifer costs are significant, making up nearly 20% of the total cost to produce milk. So when you look at these expenses, do you consider them an expense or an investment? You could ask yourself, what is the best possible way to raise replacements for my operation? Should I raise all my replacements? Should genomic testing for superior animals be considered? Am I using sex semen on the best heifers and cows? Should I breed the bottom quarter to beef bulls for additional income? Those are all questions that should be reviewed depending on where you are in your operation in regards to needing heifer replacements on the farm. So to start, we go back to the calf. The dairy industry has improved many management practices to reduce mortality and treatment rates on calves. Going back to the NAM studies, previous mortality rates were closer to 20%, and most currently we are closer to 8%, so we are improving. Most of these death losses, though, are still occurring within 3 weeks of life, and most treatments for illnesses are occurring before weaning. While this is the average, this can widely vary from farm to farm, as low as 1% death loss to as high as 70%. Calf management starts even before the calf is born, making sure that the cow is provided with a clean, dry, low-stress maternity area. This includes moving cows into the far, dry, or close-up pen weekly, or within 2 to 10 days of calving, or in a way that minimizes the number of pen changes to avoid stress and setback on feed. Moving these animals in a stress-free manner, particularly during early labor and providing adequate space and sanitary area for calving, is critical for a first start. When we look at another area before that calf is first born, it could lead to dystocia. Dystocia refers to the abnormal or difficult delivery process and can be derived from the effects of multiple sources like the fetus, the dam, the sire, the breeds, environment, or different management practices that are used. There is a subjective scoring system that can be used to record calving ease to help and determine which effects could be causing dystocia. But by managing and feeding heifers to calve at 22 to 24 months of age with adequate frame size, we can reduce this incidence of difficult calving on those first calf heifers. Calving ease sires is also recommended for first calf heifers. As mentioned earlier, those pen changes are very important for the cow to adapt to her calving environment. Once the calf is born, it's time to consider those first critical 24 hours of the calf's life. It's recommended to move the calf into a more thermal neutral environment around 60 to 75 degrees Fahrenheit, and particularly in wintertime to help with drying the calf. The use of clean warming boxes or rooms and calf jackets will help in drying the calf. By removing the calf as soon as possible from the dam, this also helps reduce changes of exposure to pathogens. So by hand feeding the calf, we can ensure the calf receives adequate high quality colostrum. After birth, the umbilical cord is a hollow tube that pathogens like E. coli can travel up and into the calf's circulatory system by the liver. This causes infections, which can also lead to joint ill. The use of iodine will kill most pathogens with short contact time and help dry out the cord tissue, speeding up the rate of closure. This may need to be repeated 24 hours later, but it's important to monitor the navel area for at least 3 to 5 days to make sure that it is still soft and pliable. If it becomes enlarged and swollen, then antibiotic intervention may be needed. So let's talk about colostrum management. The immunoglobulins are the most critical piece of colostrum and are made up of large proteins. There are essentially 3 types of immunoglobulins present in colostrum. If you are measuring colostrum or you're reading a bag of colostrum replacer, you most commonly hear IgG. That's because it makes up nearly 90% of the immunoglobulins in colostrum. This is what helps identify and destroy invading pathogens. Colostrum also contains leukocytes, cytokines, growth factors, and antimicrobial agents that we are continuing to learn more about how they affect the calf's developing immune system and gut development. Colostrum contains twice as much dry matter, 3 times as many minerals, and 5 times as much protein as whole milk. It also is higher in energy and vitamins. The high content of vitamins A, D, and E and fats in colostrum are especially important because the newborn calf has very low reserves of these nutrients. And in addition, the relatively low lactose content, colostrum reduces the incidence of diarrhea. So while this data was published nearly 20 years ago, the nutritional content has not changed much at all today. In a recent study at Penn State, looking at nutritional content of colostrum, minerals and some vitamin levels were the only noticeable higher levels in colostrum samples. This most likely reflects more attention to feeding our dry cows more vitamins and minerals than we did in the past. Colostrum or maternal antibody protects neonates for the first few weeks and even months until the neonate can build up their own immune system and acquire an immune system to produce their own protective antibodies. Calves with colostrum acquired immunity can be exposed to larger amounts of pathogens and suffer less severe effects. Colostrum quality and the timing of colostrum intake directly affect the level of the antibodies in a newborn calf's bloodstream. There have been many studies to show the benefits of successful transfer of passive immunity. They include reduced treatment and mortality rates, improved growth rates and feed efficiency, increased first and second lactation milk production, and decreased age at first calving. The most important part of growth starts on day 1 with colostrum. It still remains the single most important management factor for calf health and survival. We'll review these 5 cues for the remaining portion of this presentation as they are the building blocks for any colostrum management program. So first, we focused on quality, making sure calves are receiving the highest quality colostrum of greater than 50 grams per liter of IgGs, or a total of 150 to 200 grams of IgGs at their first feeding. Then quantity. A good rule of thumb is 10% of their birth weight, or 3 to 4 liters. Then quickness is key to make sure we are getting the high quality amount into the calf so that she can utilize the nutrients and antibodies. Squeaky clean has been added in the last few years as we take a look at how milk has been collected, stored, and delivered. We don't want to be feeding a mouthful of bacteria to our calves, so learning the impacts of pathogen loads is also important to IgG absorption. And finally, once we have administered colostrum, how does a farm monitor or quantify the program? This helps evaluate the colostrum program and learn if there needs to be a review or change in protocols. So let's look at the 5 cues a little more in detail. In 2014, the NAM study did extensive work to evaluate calf management and in particular colostrum. In nearly 2,500 calf samples, colostrum samples were also evaluated to evaluate quality. This chart shows that nearly 70% of those calves did receive excellent colostrum. However, there still remains nearly 30% of those calves that did not receive high quality colostrum. So what does make good colostrum? Well, a good dry cow vaccination program is important to the immune status of the dam as it relates to her pathogen exposure and ability to provide antibodies in the colostrum. Vaccines that are in part for the calf should be administered timely as well to allow those antibodies from the blood of the cow to be concentrated into the colostrum. Also, dry cows fed too little protein or energy tend to produce lower quality colostrum than cows fed adequately. Age of the cow is of importance. 2-year-old cows tend to produce lower quality than older aged cows. Leaking milk pre-calving can also reduce antibody levels because of colostrum removal or just by dilution of that colostrum coming into milk. Breed can also have an effect, as Jerseys tend to have higher levels of antibodies than Holsteins or any of our other breeds. Season of the year can also be related to quality of colostrum, as we take a look at heat stress, and temperature extremes are very problematic. So let's talk a little bit more about a few of these. Particularly during farm expansions or introducing new animals to the herd, this can be a source of low quality colostrum because it creates passive immunity issues. Typically, colostrum quality is lower in heifers, and if we're bringing those new animals in from mixed sources, then those colostral antibodies are no longer farm specific. And then also to aid in this colostrum issue, it is recommended to vaccinate to protect against specific pathogens of concern to the new farm they're entering, and also vaccinate early enough, like I said before, to allow antibodies to be secreted into the mammary gland for colostrum production. However, just by looking at this picture, you can see that vaccines can't and don't protect against overwhelming pathogen loads. The environment and management practices in which we raise our cows, we need to be raising healthy animals, and that still need to be followed protocols. Another source of colostrum issues is heat stress. Within the last few years, we've seen more research on the impacts of heat stress, not only on the cow, but on the calf. So let's look at this a little bit further. Cows typically become heat stressed when combined air temperature and humidity are at 60 degrees Fahrenheit. This is when we begin to see heat stress and a drop in milk yield. Cows become much more heat stressed sooner than humans. We can tolerate temperatures up until around 80 degrees Fahrenheit. When more blood goes towards your body surface for cooling, less becomes available to serve your muscles, brain, and other internal organs. And prolonged sweating draws a lot of water from the bloodstream, further reducing its capacity to deliver nutrients, clear out waste, lubricate joints, and cool you later. You can easily sweat out 1 quart of water during an hour of heavy work in hot weather. So imagine those type of effects on our cows as well. You know, they're weighing close to 1,400 pounds and giving off a lot of heat. So definitely a very stressful time, and particularly in that dry period. Heat-stressed cows during the dry period produce less milk, and that's been evident for many years. As we take a look at this graph, the research just points to more milk production from cows that are cooled during the dry period than cows that are heat-stressed. So what does that have to do with a calf's first day of life? Well, let's look at the next slide. As more recent research, there's just been more compelling data to show that heat-stressed cows have a profound effect on calves not even born yet. So calves that are born from heat-stressed dams are actually lighter at birth through 12 months of age. They have a compromised transfer of immunity, meaning even if they receive high-quality colostrum, their ability to absorb IgGs is compromised. Fewer survive to complete their first lactation. They have poorer fertility outcomes and lower milk production in their first lactation. So even though this presentation is highlighting the first day of life management, key factors prior to the calf even being born are so important to the future of their life. So cooling cows during late gestation is, going to be effective to help lessen those impacts of heat stress on those newborn calves. Then we move to the second cue, which is quantity. How much should we be feeding at that calf's first feeding? The goal has been targeted for at least 150 grams of IgG. So typically this means to be feeding 10% of the calf's body weight, or about 3 to 4 liters. We are seeing some new standards being drawn up here in the next year. They're coming out of the NAM study, and with many of the new calf researchers, that new standards might be being released that are now recommending feeding closer to 300 grams of IgGs. So colostrum quality is going to be very important to measure moving forward, and I'll go into more detail in the next couple slides. So this increased rate of IgG has also shown to reduce death loss and treatment rates above the typical standard. So that's kind of why we're moving to feeding even more IgGs than we had in the past. A question that I get asked a lot is whether a bottle or esophageal tube feeder is better when we're feeding that colostrum. And research will show that both work equally well as the feeding method, and they really have no effect on total serum protein or the IgG levels in those calves. So just proper training and equipment, cleaning, sanitation, those things are important to monitor. And tube feeding can be used, but it's really recommended that we don't use it multiple times on that calf, as it really does irritate the calf's esophagus the longer we use it. When do we feed colostrum? So that's the third cue, as quickness. As we look at this timeline, you'll see the longer we wait to feed colostrum, the less likely the calf will be able to absorb IgGs. Calves can only absorb antibodies in the first 24 hours of life through the small intestinal wall. So a goal for feeding should be within 1 to 2 hours after birth, and at max 6 hours for that first feeding. So before calves are born, they are in a sterile environment, and so disease protection isn't necessary. That dam is supplying all the protection needed before birth, but the calf is born essentially devoid of any antibodies. So during that calf's first 24 hours of life, it can absorb whole antibodies through its small intestinal wall. These antibodies circulate in the animal's bloodstream to help fight off diseases and infections during the first few weeks of life. If we look at this diagram, we see the intestinal wall is currently open, allowing IgGs to pass through the intestinal wall and made readily available for absorption into the bloodstream. As time goes on, this opening starts to close and reaches a point where no more IgGs can pass through. So while the calf can still absorb nutrients such as protein, vitamins, and minerals, the IgGs can no longer be absorbed, and the calf can be made more susceptible to disease or infection. So while the first feeding of colostrum supplies the majority of the IgGs needed, there are benefits to adding a second feeding of colostrum if the farm is able to put that into their protocols. This research study actually demonstrates that the use of a colostrum supplement after that first feeding provided some reduction in incidences of scours, less cases of respiratory disease, and just overall lowered antibiotic usage through that pre-weaning period. The fourth cue is the word squeaky clean, and this is something that we've added here in the last few years as we are handling milk differently, collecting it from cow, going into storing and freezing, cooling, thawing, all these different processes, and there is a lot of cleanliness and sanitation that has to happen along the way. So in this presentation, I'm going to focus on most of those except the pasteurization and cleanliness, and we're going to include those in the nutrition and hygiene presentations further down the line. So the first part we want to look at is looking at a particular study conducted by ISU in 2012, looking at colostrum samples throughout the whole United States, and trying to determine what percentage of those colostrum was both of high quality from an IgG standpoint as well as cleanliness standpoint, so meaning bacterial contamination from handling, storing, and collecting. And basically what this study concluded was about half of the industry, or half of the samples that they collected, met industry samples or standards for total plate counts, so the bacteria levels. Nearly 30% did not meet standards for IgG concentration, And when you put the total plate count, so the bacteria load and the IgG concentration together, only about 40% met both of those requirements. So in that study, overall, to reduce bacterial contamination, they really stress that colostrum should be fed immediately or frozen as soon as possible and not stored in the refrigerator for more than 24 hours. So there's basically three major sources of bacterial contamination that can be derived. And first, when we bring that cow into the milking center, we have to make sure that her udder and her teat ends are clean. We have to remember that she hasn't been milked for 50 to 60 days. And so making sure that it's properly cleaned before we put that milker on, that's going to reduce some of that contamination. And then the second thing to look at is the collection, storage, and feeding equipment. So sometimes this equipment might get overlooked as part of the daily cleaning and sanitation protocol. And then we end up getting some biofilm buildup, which can be offering a home to bacteria. So really need to take a look at that. And we'll go into more detail on that during the hygiene and sanitation presentation. So the third is just bacterial growth in actual stored colostrum. So it's important to note what's happening to the colostrum once it's collected from the cow. So is it staying in the milking area until the end of milking? Is it being fed right away, or is it being properly cooled? First thing to take a look at is colostrum harvesting and storage. Storing high quality colostrum is a good management practice. Surplus colostrum can be used for quality colostrum when it's not available for a newborn calf. But the bacteria can develop on colostrum that is stored. So let's take a look at how fast this can develop. Bacteria loads can double in 20 minutes. So let's say the bacteria concentration in the milk bucket that you've collected milk from is already at the maximum cutoff point of 100,000 colony forming units per milliliter, and the farm waits until after milking to put it into the refrigerator. So now that milk has been sitting out for nearly an hour at room temperature. And at the end of the hour, that bacteria count now has increased from 100,000 to 800,000 colony forming units. So feeding or storing as soon as possible is critical to that process. And research does show that high bacteria counts are associated with decreased IgG levels in colostrum-fed calves. I thought this was an interesting graph, just kind of looking at how we can actually slow down the rate of bacterial growth in stored colostrum. This research came from University of Minnesota, looking at the growth rates of just storing raw milk, and then storing raw milk with a preservative called potassium sorbate, pasteurized milk, and then storing pasteurized milk with the preservative potassium sorbate. So the rate at which bacteria grow is considerably less for that milk that's been pasteurized, or that combination of pasteurized and potassium sorbate, versus any of the raw milk or raw with potassium sorbate. So I thought it was an interesting graph, and then just showing that after about day one, you'll either want to get that milk out of the refrigerator and freeze it, or get it fed right away. So again, refrigeration for up to 24 hours, and anything longer than that should be frozen or fed. And we can freeze colostrum for up to a year without significant decomposition of antibodies, but the repeated freeze-thaw cycles does shorten the colostrum storage life. So after about a year, if you haven't used it, it might be time to get rid of it. Freezing colostrum in bottles or gallon plastic bags is a really good method for storage. However, I do prefer plastic bags over bottles or other storage containers, because the thawing process allows for more of an even distribution when using a plastic bag versus a plastic bottle. And then the same problem can occur with bacterial growth when we're trying to thaw that colostrum out. So, when we're thawing that out, making sure that we can pour off any of the liquid portion and stick it in the refrigerator until the whole bag or bottle is completely thawed out. That's going to help reduce the bacterial growth. And then also keeping the milk water that we're thawing that colostrum to less than 120 degrees, because anything above that, we're going to start to denature the proteins in the colostrum. Then anything that we've done to store high quality colostrum, we've just destroyed in putting hot water over it. So we just want to make sure that the water temperature that we're using is not going to destroy those good antibodies. So many producers have moved to a kind of a manufactured thawing unit. If you look at the picture here, the bottom right, that's a manufactured thawing unit. And so it just allows for a better distribution of thawing, and it's a warm water bath, so it's always at the right temperature. You don't have to worry about what the temperature that you're putting it in. It's always consistent. So before feeding or storing colostrum, I think it's important to evaluate the quality of that colostrum. So there's a few quick, easy methods that can be used on farm to determine IgG content of the milk prior to feeding. So the goal of any operation would be to have over 90% of your samples test greater than 50 grams per liter of IgGs. So whether you're using a Brix refractometer or colostrometer, the cut point should always equal or be greater than 50. And this will help in determining the amount to feed the calves in their first feeding to reach the recommended goal. When we look at the NAM study back in 2014, a lot of producers said they use visual appearance to rate how good of a quality the colostrum is. And well, that's a good indicator of how colostrum looks in terms of color, maybe if it's watery or bloody, or maybe got fecal material in it. It's really not a good estimate of IgG concentration. We can't tell by looking at a bucket of milk if it has 50 grams of IgG or if it has 20 grams. So tools like a Brix refractometer or colostrometer are going to be better able to provide an estimated number. So the first tool we can look at and has been around the longest is the colostrometer. This measuring device measures the specific gravity or how thick the sample is, and it's really correlated to the IgG content of the colostrum. And this works best to separate good quality from poor quality just by the indication of the color. When you drop that hydrometer into that milk, it's going to level out at either the green, which is high quality, the yellow, which is medium quality, or the red line, which is low quality. But it's important to note with the colostrometer that it is temperature sensitive, so which means we need to probably be measuring this colostrum at room temperature to get the most accurate reading. However, if you are testing it when it maybe comes right out of the cow or you're taking it out of the fridge, just making sure you're factoring in that temperature variation, because cooler temperatures are going to cause the colostrum to thicken, and then it's going to result in overestimation of its quality. So colostrometers are relatively easy to read and they're quick. They're inexpensive, around $50. So, but it does contain a glass instrument, so it's fragile and it could probably break more often. It is also more temperature sensitive, so just important to factor that in when you're training people to evaluate colostrum quality on the farm. So a lot of people have moved to the optical Brix refractometer as maybe more of a accurate reading. It's not as temperature sensitive as the colostrometer. It was originally designed to measure the amount of sucrose or sugar in solutions, and now it's been adapted to correlate with the content of IgG in colostrum. So using that light prism to measure protein refraction in colostrum, just the way the light bends, that's going to give you the reading. So the denser the substance, the slower the light will travel through it, and the higher its reading. This just kind of shows how to use an optical refractometer. It only requires a few drops of colostrum right on that prism, and then you close the sample cover lid, and then you'll hold that refractometer up to a light, and where the line between the light and the dark areas appear on the scale is the value that you would actually read. So when you're looking at that refractometer and you want it to equal at least 50 grams, the Brix refractometer should read between 19 and 22 to be high quality. And I know some farms choose to use a higher cutoff to elevate the amount of IgGs used or being fed per liter on their farm. It's just a guideline for them. Again, it's quick and easy to use and maybe less fragile than the colostrometer. Still fairly inexpensive, around $100, and can be used for other things on the farm. So you can measure total solids in the milk. If you're collecting blood samples on calves, you can measure serum IgG levels. So it does become multi-purpose there. The downside to the optical version of the refractometer is when you're evaluating colostrum. Colostrum has a lot of fat, and so that fat is going to cause a blurred band rather than a really distinct line when you're reading it. And so that can cause some error in the measurement of quality. So that's just something to consider when you're looking at that. But proper cleaning and handling, it's going to help with that residue and maybe be able to see that a little bit clearer. So again, now people are moving more towards a digital Brix refractometer, where it just gives you an output of a number versus having to look at a line and determine what it is. And it serves multi-purpose for the total solids. A serum can be also measured there too. So it is a little bit more durable on farm, but it is more expensive. These devices are $400 or $500, so proper training in usage and handling of it is going to be important as well. There are situations on the farm where fresh or frozen colostrum is not available. So whether that's the fresh cow didn't produce enough, or there's not enough high quality, there's not enough time or labor on the farm to freeze and thaw colostrum. The other situation may be the farm does not want to transmit known diseases like Johne's to the calf. So a colostrum replacer can be used to provide antibodies needed for the calf that first day of life. Colostrum replacer is a recommended product to use, and it should be fed at a minimum of 200 grams of IgGs at that first feeding. So if a bag reads 150 grams of IgGs, then you might want to consider feeding 1.5 bags to get you to the level of whatever the farm decides that they want to be feeding at. So per dose, these products range from about $40 to $50. So I think there's a substantial amount of cost to it, but when you take a look at other protocols on the farm, maybe this is the better route, and you're gonna know that you have the antibodies in those calves too, and reduce your disease transmission. When we look at colostrum-derived products versus serum-derived products, the research does show that there is better IgG absorption from colostrum-derived products than serum-derived. So, and then also monitoring passive transfer from these colostrum replacers vary between manufacturer. So it's really important to know what their cutoff points for passive transfer are versus the standards that I've given you here today. So that leads us into monitoring or quantifying. That's our fifth Q of passive transfer using the Brix refractometer or clinical refractometer. So this will give you another reading to look at, and this is after the calf has consumed the colostrum. We're going to take a look at blood serum levels. The protein levels within those calves is usually associated with those IgG levels. So if calves have received enough high quality colostrum, serum total protein will be 5.5 grams per deciliter or greater when using a clinical refractometer. And when we have a total protein that falls between 5 and 5.5, that increases their risk for mortality and morbidity. And anything below 5 puts that calf at high risk for more health problems down the road and immediate for future. So if we're using the digital or optical Brix refractometer, if you get a reading of 8.4%, that would indicate success in passive transfer. As I was mentioning in this presentation, there is some ongoing research and development of updating the monitoring standards and looking at NOM studies, and also assembling quite a few calf experts out in the industry and reviewing key papers in the last 10 years. They are going to be looking at updating those standards. So I did give you a few of those today with the 300 grams of IgGs being recommended. And a lot of these monitoring passive transfer numbers will also be updated as well. So just because they're just seeing further reduction in mortality and morbidity rates with even higher levels of serum IgG. So with these new goals, they're going to separate them into categories of excellent, good, fair, and poor, and put cut points within those different categories. So most likely those are going to be the new cut points moving forward. So just in review, as an industry, we use these 5 Qs in managing colostrum and providing the most success of passive transfer in that calf's first day of life. So by using these benchmarks, we can develop protocols on the farm to best manage healthy calf outcomes. You know, in many farms, when we have health issues arise, going back to that colostrum protocol and knowing, you know, what we're doing in each of those steps, that's really going to help evaluate the calf management program. So just to conclude, this slide does provide access to many of the resources available within Iowa State University Extension and Outreach Dairy Team. And the additional links that I have above there highlighted in blue are links that I think would be good references for this presentation. It includes our YouTube channel, which has a lot of videos on farm demonstration of much of what I talked about today. So I just feel like that would be a good resource for this presentation. So thanks for joining me here today in part 1 of 4 in raising gold star calves.